What do stroke court, MRI, CTA, MRA scans show? Imagine trying to find out what's happening inside the brain during a stroke. Doctors use different scans to get a clear picture of what's going on. Each type of scan offers unique information that helps guide treatment and understand the stroke better. Starting with the computed tomography scan, or CORT scan, it's often the first test used when stroke is suspected. It's quick, widely available, and excellent at spotting bleeding in the brain. Blood appears bright on a CORT, making it easy to identify a hemorrhagic stroke. Early signs of an ischemic stroke, which is caused by a blockage, can also be seen on CORT. These signs include a bright spot in a blood vessel called the dense middle cerebral artery sign, or areas of low density indicating swelling and tissue damage. Sometimes, the CORT shows loss of the normal gray and white matter distinction, which suggests brain tissue injury. Because time is critical, a CORT can quickly rule out bleeding before doctors give clot-busting medications. Advanced CORT techniques like CORT perfusion can measure blood flow, helping to distinguish between tissue that is already dead and tissue that might still be saved. CORT angiography, which involves injecting contrast dye, visualizes blood vessels to find blockages, narrowing, or abnormal blood flow, guiding procedures like clot removal. Magnetic resonance imaging, or MRI, offers a more detailed look, especially for early ischemic changes. It uses magnetic fields and radio waves to produce images. The diffusion-weighted imaging sequence is particularly sensitive to early stroke signs, showing areas of restricted water movement within minutes of stroke onset. MRI can reveal very small infarcts and strokes in tricky locations like the brainstem. It also helps differentiate between new and old strokes using special sequences like FLAIR. While MRI can detect bleeding as well, interpreting these images can be more complex than CORT. Mr. Angiography, which is a type of MRI, can visualize blood vessels without needing contrast or with gadolinium contrast, helping assess vessel narrowing or blockages. The CORT angiography scan is a specialized test that combines CORT imaging with contrast dye to look at the arteries in the brain and neck. It's very fast and can identify large vessel blockages, narrowing, aneurysms, or abnormal blood vessels. This information is crucial for deciding if a patient is a candidate for procedures like thrombectomy, where a clot is physically removed from the artery. It also shows collateral circulation, which is the brain's backup blood flow, influencing how severe the stroke might be and what treatments are possible. The magnetic resonance angiography, or MRA, is similar but uses MRI technology to examine blood vessels. It can be done with or without contrast dye. MRA is especially helpful when contrast use is limited or contraindicated. It provides detailed images of arteries inside and outside the brain, helping identify narrowing or blockages without exposing the patient to radiation. In summary, a non-contrast CORT is the go-to initial test to quickly rule out bleeding and spot early signs of ischemia. MRI with diffusion-weighted imaging is more sensitive for detecting early tissue damage and small strokes. CORT angiography rapidly pinpoints large vessel blockages and vascular abnormalities, guiding urgent interventions. MRA offers a detailed, non-invasive look at blood vessels without radiation. Together, these scans give doctors a complete picture of the stroke's type, location, severity, and blood vessel health. Always remember, if you or someone else shows signs of a stroke, seeking immediate medical attention is essential. Only healthcare professionals can interpret these scans accurately and decide on the best treatment plan.